Are you unhappy with your Medicare drug plan? If so, in today's video, we'll give you 5 ways to save big on how to lower your drug copays without even changing your drug plan. Also, stay tuned to the end of the video where we'll also discuss the new 2022 Inflation Reduction Act and how they will affect you.
Pay attention to this video if you find that your medication costs with Medicare actually cost more than when you were working. Or perhaps your copays are really high and you're stuck on your drug plan until the end of the year.
However, in some cases, people need to change their drug plan. If you're going crazy shopping around each year, we'll also give you a bonus tip and show you the best and easiest way to shop for the best Part D plan during Medicare's open enrollment. Hi, I'm Kai Chung.
And I'm Ann Chung. And here is Gracie, our retirement dog. She decided to show her face again today. As your retirement advisors, we've noticed in the last 18 years that some retire with very expensive medications. Here at KCIIS, we represent over 50 different plans, and our goal is to teach you the best way to save money and to help you shop around.
Think of us like a shopping mall. We're also licensed all over the US with no bias, no quota, and best of all, no cost to you. We get paid directly through the insurance companies. All of our services are free to you as a consumer. But in some cases, even if we shop around Medicare's Part D, they have no cap and no maximum amount of pocket like some employer plans that protects you. Now, while Medicare does have a catastrophic level you can meet, which significantly lowers your drug copays, many people do not ever hit that level and are struggling to choose between putting food on the table or taking medications. Some have chosen to keep working longer since Medicare's drug plan is not as good as their employer's plan.
Many people know they can lower their drug copays by changing drug plans called standalone Part D plan, or they can change the Medicare Advantage plan called Part C. The problem is, however, in some cases, switching does not save hardly any money. Plus, if you have a Medicare Advantage plan, switching your network of doctors or hospitals just to get a lower drug plan is out of the question.
Yes, and we've helped many clients lower their medication costs in the past 18 years through 5 easy tips. So, pro tip number 1, pay cash. Yes, do not show your insurance card. Now, why would we say that? Well, there are online coupons and popular websites that could actually be cheaper than using your insurance. One that we recommend is goodrx.com. Now, some of you already know about this, but do you really know how much you'll save? Let's take a look at this website, and you'll see examples of how much people are saving on their medications.
I know this may seem too good to be true, but I can tell you many of our clients actually have used this and thanked us for it. On the website, they specifically say that you do not have to register, and they make money through advertisements and referrals.
And now, just to reassure you guys, we're not sponsored by GoodRx either. So this is an excellent option if your drug is perhaps not covered by Part D or a Medicare Advantage plan. Your copay is really high, or perhaps you reach what's called a donut hole, also called a coverage gap in your Part D plan.
Now, this does not give you an excuse to skip the Part D drug plan. You can always get the cheapest drug plan if your drugs are not that expensive to avoid the penalty. Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium times the number of full uncovered months you didn't have Part D or credible coverage. The monthly premium is rounded to the nearest 10 cents and added to your monthly Part D premium. The national base beneficiary premium may change each year, so your penalty amount may also change each year.
Confused?
Yes.
Well, rewind what she just said. But bottom line is the penalty is per month for life. And one thing I want to just mention is most years, the drug plan premium, the least expensive, is typically only about maybe $5 to $10 a month.
So while it's your choice to skip the drug plan, we do recommend you just get the cheapest one to avoid the penalty. And whether you purchase it through us or directly from the insurance companies, the price is the same. Pro tip number 2, look into your pharmaceutical assistant programs, or PAPs.
PAPI? Not PAPI. PAPS.
Programs. Right here on cms.gov, it tells you pharmaceutical manufacturers may sponsor patient assistant programs, PAPs, that provide financial assistance or drug-free product through in-kind product donations to low-income individuals to augment any existing prescription drug coverage.
That was a mouthful.
That was.
Now, it's important to know this PAP's assistance on behalf of the PAP enrollee does not count towards a Part D beneficiary's true out-of-pocket cost. The calculation of TROOP is important for determining whether you as an individual has reached the threshold for catastrophic coverage under the Part D benefit. We'll leave a link at the bottom of this page. This overview page provides important information on CMS policy with respects to PAPs and also provides some helpful links to other information. To see if you qualify, you'll want to go to this webpage on Medicare.gov. So we'll leave these two links in the description below.
And if you're unsure of the terms such as catastrophic coverage, donut hole, or coverage gap and what they mean, please check out our other videos where we will explain Medicare Part D drug plan in detail and the new changes every year.
Now, to make sure you get our future videos, please remember to subscribe. Also, you will be helping us out by clicking the like button and commenting if you felt this video has helped you so far. This actually lets YouTube to recommend this video to others who are searching the same topic.
For a third pro tip, see if you qualify for extra help through the government. Now, don't get this confused with your state welfare, Medi-Cal, or Medicaid. You are allowed to have a lot more assets and income under this extra help program.
What's the income and asset limit? Well, to see if you qualify, you can go online to ssa.gov or call Social Security at 1-800-772-1213. We'll leave all of this information in the description below.
Now, before we go into the 2022 Inflation Reduction Act, here's the bonus tip on how to compare your drug plan each year without having to go through all the confusing online websites.
Even Medicare.gov is not the easiest to navigate.
Right. That's why we have a website created specifically for you in mind. Not only a website, but specific step-by-step instructions on what to do. Also, since we represent over 50 different plans, we can help guide you when you shop around. So call us at 408-502-7080, or you can email us at support@retiringoptions.com. Fourth pro tip, if you're using your prescription drug plan, make sure you're going to your preferred network pharmacies. We liken this to your close group of friends versus just your acquaintances. Each insurance plan will have its best friends or preferred pharmacies. If you stay with your preferred pharmacies, you can also lower your drugs.
And now for our final pro tip. We'll have a very popular Part D comparison tool that is much easier to use than Medicare.gov's website. And you can also get our free in-person, phone, or Zoom support. This tool will show around 80 to 90% of all the plans out there. If you want to see all the plans, you can also go to Medicare.gov. Now, we contract with the plans that are not just the lowest premium, but also the plans that our clients have had good success and know that you will have our support behind you. Okay, now let's discuss how the 2022 Inflation Reduction Act will affect all those on Medicare prescription drug plan. First, more people will qualify for low-income subsidies. In 2022, a person who makes 135% of the poverty level or better cannot get low-income subsidy called LIS. Starting in 2024, though, LIS subsidies are available to people making 150% of the poverty level or less. Well, that's an estimated 400,000 more people that will qualify for financial help. And there are insulin costs where they're going to be capped at $35 a month as of 2023, no matter how you receive your insulin.
In 2023, the cost sharing for adult vaccines will be eliminated, making many vaccines free starting in 2023. There is also a potential $2,000 out-of-pocket cap in 2025, whereas right now there is no cap for your drug out-of-pocket costs. Medicare will also cover 100% of the drug costs during stage 4 catastrophic coverage.
In 2026, Medicare will be able to negotiate prices on some drugs, and the number of drugs eligible for negotiation will increase each year through the year 2029, which is estimated to impact more than 4.1 million people.
Please keep in mind when these benefits were created, they were passed by the previous administration and was delayed to start in 2023 and to start in 2032. So while we like these benefits and changes, we all know that anything can change with Washington, D.C.
For sure. And if these changes have a huge negative impact on Medicare costs, another administration may bridge them to keep Medicare solvent. Well, we'll leave links below for you to read in more detail regarding 2022 Inflation Reduction Act.
Our goal is to keep you posted through all these changes, and you can also follow us on our business Facebook page here on the screen. If you haven't already, please subscribe to keep up with all changes that may impact you or your friends.
We'd like to get your comment below. What do you think? Do you think these changes will actually go into effect, or do you think it will be stopped? One final reminder, remember to check your ANOC. your annual notice of changes, every year right around October. If you cannot find your ANOC, then call the insurance company located on the back of your card. Open enrollment is only from October 15th to December 7th. Each year, your Part D benefits can change, and the formulary and tiers can either be good or bad. Now, if you're happy with what you see for the following year, then there's no need to change. Go enjoy your vacation and your family time, and forget about Medicare's open enrollment.
Did you find this video helpful? Again, we'll leave all the links below for you to review. Please comment on which savings might benefit you the most and if you found this video helpful.